So this is a 56, and we're going to do it through cases, looking at cases and try and work out how we think about cases. So that's kind of the aim of this lecture, is to look at cases and work out how we work logically through them. This is a 57-year-old gentleman who presents with acute dental infection. He gets a paranasal sinus CT done as part of his dental infection. And there's a few things that are amiss on this. So it certainly looks like this guy has some sinus disease. And, if we start on the more superior slices, we've got complete opacification of the sphenoid sinuses, extensive opacification of the ethmoid air cells, but also notice this neo-osteogenesis, or mucoperiosteal thickening, whichever you want to call it, this new bone thickening that you get in response to chronic sinus inflammatory disease. And you can see it in the maxillary sinuses as well, with this new bone formation, this thickening, as well as almost complete opacification of the maxillary sinuses. Now, there are a couple of other critical findings here. One is that mucosal thickening that he has, which is pretty extensive. One is this new bone formation, the neo-osteogenesis that's going on. But there's a third thing. This patient has not had any prior sinus surgery, and from what's missing here, that would be kind of weird sinus surgery to have, but he has bone destruction going on. And if we look, here's our perpendicular plate of the ethmoid, but we're missing the vomer, which is the bottom bit coming up from the hard palate. And if you look again, we also happen to be, in addition to missing that nasal septal bone, we also happen to be missing the palate as well. So not a normal surgical procedure, but we have a patient who has mucosal thickening. He has new bone formation, so he has changes of chronic sinus inflammatory disease. But in addition with that, he has bone destruction. And in the paranasal sinuses, bone destruction is bad. It's not a good thing to have. So there are three things that are on my list whenever I see bone destruction. Number one, he could have malignancy. He could have chronic inflammation and squamous cell carcinoma secondary to that. He could have invasive fungal infection, and that's usually, for bone destruction, it's a chronic invasive, not the acute invasive that you see in patients who are immune compromised or diabetic, who have rapid destruction of soft tissues of the face. It would be a chronic invasive fungal could happen, although that doesn't really explain all these chronic changes going on here in the rest of his sinuses. But the third big group is granulomatous disease. And this is what granulomatous disease looks like. It gives chronic sinus inflammation, and then it leads to bone destruction. And there are three big flavors of chronic sinus disease. Granulomatosis with polyangiitis, which we used to call Wegener's disease, looks exactly like this. Sarcoidosis, when it involves the paranasal sinuses, and it is uncommon, but it can look exactly like this. And the third thing is cocaine granulomatosis, and that looks exactly like this, and that's exactly what this gentleman, it turns out to have. So remember, if your septum and palate is gone and you want to ride on, cocaine. So when you see destruction, we're thinking bone destruction is bad, but we're thinking malignant processes do bone destruction, and then I'm not typically expecting to see chronic changes. Granulomatous does it, and chronic invasive fungal disease does it. Very, very uncommon, but can do it. But I'm thinking something bad here. In this case, this is cocaine granulomatosis, but it absolutely could be sarcoid that is doing that. So when there's bone missing, obviously it helps if you have a history. They said, oh, we took that out. But it is not common to take out the palate, and it is not common to take out the septum like that. And this is all due to granulomatosis.